That's the next thing which we'll actually be talking about is a rifle criteria. Okay, rifle criteria. Rifle criteria is spelled RIFLE, then criteria. So it's a criteria that is used for staging acute kidney injury. Okay, so when you stage acute kidney injury, of course it's very nice. Okay, you stage it so that you can now know the level of disease you are dealing with, the type of treatments to also bring in, and all of that, So for rifle criteria, rifle is an abbreviation, and rifle stands for what? The R stands for risk, I stands for injury, F stands for failure, L stands for loss of function, then E stands for end stage. Okay, so talking about the criteria, you're actually just trying to talk about how the kidney function is decreasing and all of that. So talking about the risk, that's the R. We say that when serum creatinine is increasing more than 1.5 of the initial stuff you measured in the patient, or if the glomerular filtration rate is reducing by 25, then that's a risk. Okay, urine output is less than 0.5 ml per kg per hour for about 6 hours, that's a risk. Then when the injury occurs, when you are dealing with an injury, simply means the serum creatinine is increasing 2 times from the baseline, or glomerular filtration rate is by more than 50 times, is decreased by more than 50 times. Then urine output is less than 0.5 mils per kg for 12 hours. Okay, then when you have a failure is when the creatinine is increasing 3 times from the baseline, or creatinine is increasing more than 4 milligrams per dl with an acute rise of at least 0.5 mg per dl, or glomerular filtration is decreasing by 75%. So urine output is also less than 0.3 ml per kg per hour for about 24 hours. Okay, so loss of function is when you have persistent acute failure. Okay, there's kidney loss of function for more than 4 weeks. Then for the E, which is the end stage disease, is when the problem has actually persisted for more than 3 months. Okay, problem has persisted for more than 3 months. So that's it for the rifle criteria for trying to stage acute kidney injury.